special tools here that help you to find these cavities or cracked teeth or anything before they get to the point where a person needs a root canal?
Yes, absolutely. Some of our tools include the digital x-rays, I'm sorry. Those are very good tools. We can see a lot with digital x-rays. We can zoom in on a patient's x-ray. We can identify cracks that we probably wouldn't be able to see on a normal x-ray because of the zooming possibility. Another way that we can look at cracks is with the help of our intraoral camera. It's a wonderful camera. It allows us to zoom in as well on a tooth, and we can even show the patient, we could show you if you were here in the chair, what your tooth looks like close up. So a tooth that you wouldn't usually be able to see because it's so far back in your mouth, you could actually see with this camera.
Could we take a look at that now?
Absolutely.
How you would use it?
Absolutely, Rick. This is the little camera. You see it's very small. It can be placed into the very back portion of the mouth. And let's say this is the patient's mouth. We position it over the tooth that we want to see, like this tooth, let's say, with this big, giant silver filling. And you can see it. It's about 15 times bigger than it usually would be, and you can see every little detail of the tooth. Let's see some other teeth here. See, you can see all the little details. Over here as well, this looks more like a cracked tooth.
What would the patient be able to see in there, or you would be able to see in there that would possibly lead to some form of treatment?
Well, zooming in here on the silver filling, this is a good example of something that I would show a patient and that I would be able to look at details with. This is a big silver filling that should be replaced for what we call an onlay, or maybe even a crown. So if we see crack lines through the tooth, it's very easy to identify them when we're using this little intraoral camera. It's very easy for the patient to see so that they know what we're talking about.
I know that's just an example and obviously not real teeth, but is there any dental problem you could point out on that silver filling?
Absolutely. This silver filling shouldn't be here. It's too big of a filling for too little of a tooth. Silver, unfortunately, has mercury. Mercury, every time you drink something hot, it will expand. Every time you drink something cold, it'll contract. That's a very bad property when you have a big filling inside a small little tooth. That's the number one reason why teeth end up needing to be crowned, is because a tooth cracks when it has a big silver filling like this. So this should be replaced.
So if I had that silver filling in my mouth and I drink hot coffee, the metal expands, it pushes on the tooth.
You got it.
And then later I'm eating ice cream and now it contracts and the tooth is being pushed and pulled.
You got it.
Until it cracks.
Until it cracks. First, it starts out with little tiny crack lines. Since this isn't a real tooth, we don't see it here. On a real tooth, you would certainly see crack lines coming from this filling into the tooth. And then eventually the tooth just cracks altogether. A portion of it. Hopefully it doesn't crack into the canal.